Coming up in a few moments, Dr. Kevin Kavanagh will join us and cover the latest in terms of the coronavirus. As we're on that subject, 87-year-old Larry King was hospitalized over a week ago with the coronavirus, COVID-19. There's no word on his condition, but he's in isolation and unable to receive visitors. Larry survived a stroke and underwent heart surgery in 2019, and last year he lost a son to a heart attack and a daughter to a lung cancer just weeks apart. Lou Gossett Jr. ended up in a Georgia hospital last week with coronavirus, but he left after a few days against doctors' orders because he got freaked out about all the people dying around him in the COVID wing. He is 84, and no doubt you've heard that COVID took Dawn Wells last week. She played Marianne on Gilligan's Island. She was 82. That leaves Tina Louise, a.k.a. Ginger, as the last remaining castaway, and she is 86. Dr. Kevin Kavanagh is a retired physician and also founder of a national organization just about ready to go international, Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
Disturbing news this morning, positivity rate over 11% in Kentucky.
Well, I can't say that disturbed because even if you adjust the data for what you would expect it to be, it is still way, way too high. But I think that may be an aberration because we did not have a lot of testing over the Christmas and New Year's holidays. And what that means is that your Walgreens or wherever they're doing testing, you're not going to be able to have a test if you just have mild symptoms. Hospitals were still doing tests, so patients are going to be more likely to be positive. The thing that I'm a little disturbed about is that we have on average 2,500 or more citizens dying of COVID-19 every day. We should be doing this 24/7. To me, to take off holidays, to take off weekends, that's not an excuse. We shouldn't be doing that. We should be viewing this surge as a war and confronting this with everything we have. Now, to do this, you can't simply open up a health department. You're going to have to supplement it with the needed resources and people to do that. And so one of the things I would suggest or consider is even getting the National Guard and calling up other people in order to help out. So I really think we need to really look at, should we be closing down our efforts on weekends? Should we be having aberrations in the tests? Nationally, we're having trouble getting the vaccine out. Well, they give it as an excuse. It's over the holidays. But we need to ask ourselves, is that really an excuse? I would say no. We need to be 24/7 in our fight against this.
Not good. And Dr. Fauci's warning 4 states their COVID-19 risk rate is spiraling out of control.
That's correct. That's Ohio, Tennessee, Kentucky, and Indiana. And again, that's based on test positivity rates. Either the rates are correct and we are in trouble, or the states are, again, they're not testing and they're not confronting this pandemic as they should be over the holidays. Either one is not a good situation. So I do think we need to be vigilant.
Why do you think the vaccine rollout has been a lot less effective than we thought in terms of numbers?
Well, right now, at the end of the year, we were promised 20 million doses in the arms. And earlier this year, I thought there would be even more than that because of Operation Warp Speed. I was thinking more like 25 to 50 million doses in arms. But we've had only between 2 to 3 million. So this is not very good. Distribution has been a problem. There's been a problem in getting people trained to reconstitute the vaccine. So this isn't just on a state level. I mean, a lot of this is federal level problems. And of course, not getting the state resources in order to implement this. So Operation Warp Speed to me was a huge disappointment as far as vaccine distribution. And I do think it is key to distribute the vaccine and get vaccinations. Because remember, vaccines do not prevent disease. Vaccinations do.
And on the subject of Dr. Fauci, he has come up with a list of places that he thinks you should just avoid, even if they're open legally, these places. You want to share that list with us?
Yes, and this is what I've been talking about now for several weeks. We're talking about bars, nightclubs, indoor restaurants, gyms, indoor religious services, movie theaters, musicals, cruise ships. All of these are places that are indoors. Air circulation may not be the greatest. You're apt to be aerosolizing the virus by either exercising, shouting, screaming, singing. And of course, an aerosolized virus can travel much further than 6 feet, can float in the air for hours, and can defeat a cloth mask. So during this viral surge, it's best to play safe and to avoid those places. Also, I want to add that there's some places that you might catch COVID that you really don't suspect. And this was written in an article. They listed 35 places. And I really wanted to concentrate on the lower end because people may not realize that when you're out walking and jogging or hiking, you can still catch and transmit COVID, especially during the winter months where it's cloudy, cool, low humidity. That all can have the virus survive longer, and it won't kill off the virus like a hot, warm, humid, sunny day. And so if you're jogging, you can't wear a mask because the mask will get sweaty, you can't use it, but that doesn't mean you have a pass to jog past someone. You should be going out of your way to stay 20 or 30 feet away because when you're huffing and puffing, you're really aerosolizing that virus. Likewise, if you're out walking or walking a dog, you should be wearing a mask, especially if it's on a crowded pathway.
I was under the impression that we were much, much safer outdoors and that we didn't have to worry so much about those kind of things, but not true.
Well, we're safer, but not completely safe. And we're not as safe in the winter because it's more humid, it's cloudy, and it's cooler. All of those promote the virus to survive as opposed to a warm, sunny day. So we really do need to wear a mask if you're just out walking on a sidewalk or a crowded walkway. And if you're jogging or bike riding where you can't wear a mask, you want to give someone 20 to 30 feet clearance.
All right, sir. We will talk to you on Wednesday. Thank you.
All right. Thank you, Jack.
That's Dr. Kevin Kavanagh. He's a retired physician and founder of Health Watch USA.